Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Bunionectomy. Introduction. A bunion is a hard bump at the base of the big toe. It happens when bone or tissue around the joint at the big toe's base grows. It can cause the big toe to point inwards towards the other toes. Your healthcare provider may recommend surgery to remove the bunion and correct the foot. This is called a bunionectomy. This program will help you better understand bunions and a bunionectomy. It explains the benefits and risks of the procedure. Anatomy. The feet consist of many bones, joints, and soft, flexible tissues. Joints are special hinges that separate bones. Joints, along with muscles, allow the foot and toes to move. The foot has 5 toes. The big toe is called the hallux. The big toe connects to the foot by a joint. This joint is known as a metatarsophalangeal joint. Bunions typically affect this joint. Joints are covered by a fluid-filled cushioning sac known as a bursa. A normal, healthy big toe is fairly straight with the tip pointing in relatively the same direction as the other toes. Bunions cause the tip of the big toe to turn inward towards the other toes. Symptoms and their causes. A bunion happens over time when weight is distributed improperly across the foot. This can enlarge the joint at the base of the big toe. Improper weight distribution can be the result of tight-fitting shoes. It can also be caused by injuries to the foot or by the inherited foot's shape. The exact cause of a bunion is unknown. A bunion can be painful. It can cause bursitis, a painful inflammation of the bursa. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Prevention. You may be able to prevent bunions that do not cause pain from progressing into a painful problem. Wearing properly fitting shoes is the best way to prevent bunions from getting worse. There are some things you can do when selecting shoes to make sure you get a correct shoe fit. Pick your shoes based on how they fit on your foot and not by the size it is marked. Different shoes use different sizes for their measurements. Find a shoe that fits the shape of your foot as closely as possible. Measure your feet regularly. Your feet may not be the same size. Fit your shoes to the largest foot. Usually, your feet are a little bigger by the end of the day. Try on shoes at the end of your day and stand while you are trying on the shoes. Make sure there is enough room, around ½ an inch, for your longest toe. With proper preventative measures, painless bunions may not progress and may not need surgical treatment. Alternative treatments. If your bunion is not severe, changing your shoes to a more comfortable design with more space for your toes may help. Bunion pads and medical or athletic tape can be used to hold your foot in a more normal position. Special pads for your shoes can be used to help distribute weight more evenly. Prescription orthopedic shoes and inserts may also be helpful. Over-the-counter medications like acetaminophen and ibuprofen may be helpful in reducing pain and inflammation. Steroid injections around the joint may also be helpful. When non-surgical treatments fail to control the pain or a bunion is severe, surgery may be recommended. Surgery to remove and correct a bunion is called a bunionectomy. Surgical treatment. Bunionectomy operations are done through a skin incision. Bunionectomy procedures vary widely. What your healthcare provider decides is best for you will depend on your condition and his or her preference. All procedures aim at repairing the damaged foot. This surgery is usually done under regional anesthesia. This means you will not be able to feel pain in the foot being operated on, but you may still be awake. You may also be given a sedative to help you relax during surgery. At times, a bunionectomy may be done under general anesthesia. This surgery is usually done as an outpatient operation, meaning the patient goes home the same day of the operation. It usually takes an hour or two. Some procedures shave off the bump on the toe joint and remove the damaged portion of the joint. Screws, pins, wires, or plates may be used to hold the joint together after the damaged portions are removed. This is known as an arthrodesis. The length of involved tendons may be adjusted to correct the bunion. Swollen tissues from around the enlarged joint may be removed. The bones in the foot may be permanently joined or fused together. Your healthcare provider may perform an osteotomy. This involves reshaping the bones of the foot by taking some bone out and realigning the rest. Risks and complications. This surgery is safe, but there are several possible risks and complications. These are unlikely, but they are possible. You need to know about them just in case they happen. By being informed, you may be able to help your healthcare provider detect complications early. The risks and complications include those related to anesthesia and those related to any type of surgery. Risks of general anesthesia include breathing problems and allergic reactions. Your healthcare provider will discuss these risks with you and ask if you are allergic to certain medications. Blood clots in the legs can happen due to inactivity during and after the surgery. These usually show up a few days after surgery. They cause the leg to swell and hurt. Blood clots can become dislodged from the leg and go to the lungs, where they will cause shortness of breath, chest pain, and possibly death. It is important to let your healthcare providers know if any of these symptoms happen. Sometimes the shortness of breath can happen without warning. Getting out of bed shortly after surgery may help decrease the risk of this complication. Some of the risks are seen in any type of surgery. These include 1. Infection, whether deep or at the skin level. Infections can involve the skin incision. Deep infections may involve the bone itself. Treating deep infections may require long-term antibiotics and possibly surgery. 2. Bleeding, either during or after the operation. This may necessitate another operation. 3. Scarring of the skin. Other risks and complications are related specifically to this surgery. These are rare, but it is important to know about them. The incision may not heal well. This could lead to another procedure. Nerves could be damaged and cause numbness in the big toe. The bunion may return after treatment. This is not common. The tendons that attach to the big toe could get damaged. An overcorrection of the bunion called hallux-valgus may happen. This is when the toe points outward and away from the second toe. There is a chance that this surgery may not make the pain go away or may make it worse. After the surgery. This surgery is usually done as an outpatient operation, meaning the patient goes home the same day of the operation. You will not be able to walk on or put any pressure on the healing foot for a few days. You may need crutches or a walker. After this period, your healthcare provider may ease you back into using your foot. This may include special footwear. Your foot will be bandaged. Your healthcare provider will ask you to keep your foot elevated above the heart level to reduce swelling for a few days. When you bathe, you will need to cover the dressing with a plastic bag and make sure that you keep the foot dry. Make sure to call your healthcare provider if your dressing becomes loose or wet. If you notice drainage or wet blood on your dressing, contact your healthcare provider right away. Your healthcare provider may recommend special exercises or physical therapy to help your foot heal and strengthen. Call your healthcare provider if you have signs of an infection. Signs of an infection include fever, chills, redness or warmth around the incision site, increased pain, and swelling in the leg above the treated foot. Your healthcare provider will tell you how long it will take before you can go back to work. This depends on your age, type of work, and your type of surgery, as well as other factors. Your healthcare provider will arrange a follow-up visit to examine the incision and remove any external sutures and pins.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. A bunion is a hard bump at the base of the big toe. It happens when bone or tissue around the joint at the big toe's base grows. It can cause the big toe to point inwards towards the other toes. A bunion happens over time when weight is distributed improperly across the foot. This can enlarge the joint at the base of the big toe. If your bunion is not severe, changing your shoes to a more comfortable design with more space for your toes may help. Bunion pads and medical or athletic tape can be used to hold your foot in a more normal position. Surgery to remove and correct a bunion is called a bunionectomy. It is a common outpatient procedure. Bunion surgery is safe. Risks and complications are rare. Knowing about them will help you detect and treat them early if they happen. Make sure to ask your healthcare provider if you have any questions. Thank you for using Explain.